this is a cross section through the head. We can see the oval of the skull bones there beautifully. We check the head size. And that looks normal. We can see the midline that divides two halves to the brain. That looks nice and symmetrical. And we can see the lateral ventricles, which are the fluid-filled spaces within the brain. One there, one there. That look normal. We can look at the cerebellum, which is a balance centre at the back of the brain. It needs to be normal in shape and normal in size, and it is. And we look at the area at the back of the neck, and that also looks normal. Fibroid?
Yeah.
We'll look at that soon. The moment we'll look at the hands hiding the face. There's one hand just up here. You see the thumb and the four fingers waving. And then there is the other hand. So they're doing this. The thumb and its four fingers. So both hands are normal and face is hiding. We come on down there is the spine, and that looks beautiful from this angle. You can see the skin line all the way down, the little dots of the spinal bones, perfectly normal. No gaps, so no evidence of spina bifida at all. That's the base of the spine, the sacrum. That's the hip bones, little dots of the spinal bones, the ribs, the shoulder blade, all the way up to the top, and they look normal. Look through the back. Little C-shape there and C-shape there are the two kidneys, both in the right spot, and both looking absolutely fine. So they look lovely. It's the spine here again from the back and cross section. And as we come up and down, we can see a little oval just there, and there are two kidneys, both in the right spot, and they both look normal. Now, while we're waiting for the baby to turn around, let's have a look at this fibroid. That's a good sign. I'm having trouble seeing it. Where was it last time?
Just towards the bottom.
Back. Okay, that's it there. Just in there. It's looking good. It's smaller. So that's excellent. Baby is very shy today. There's that spine from the back again. You can see the ribs there beautifully. We can look through the back past the spine. There's a C shape there and a C shape there. That's two kidneys, both in the right spot. We look from this angle, we can see this. Here are the legs. So right down the bottom, one leg stretching out there. Two legs side by side now, coming down to 2 feet. There's 1 foot. See the toes. There's the other foot, just down there. So those legs kicking out, stretching out. This here is the thigh bone. That is normal in length. This here is the waist. That is normal in size. Black space there is the stomach. And here is the heart. So there is the heart just there. There's 2 atria, there's 2 ventricles, so 4 chambers in total. You can see them just there. You can see the septum there. We can see the valves opening and closing. They look good. There's that septum coming down the middle there, looking lovely. We check the blood flow through the heart. So there is good flow into each side, no flow across the septum, so no evidence of a hole. Red is up and blue is down. So we use this to make sure that the vessels are not only looking good, but that they are flowing in the right directions. And they are. So that's looking great. Check the heart rate. Beautiful. .129 beats a minute, perfectly normal for this stage. Now, turn your head to me, please, baby. I'm not that bad. Can you jiggle your hips, see if you can get the baby to turn over? I'm not looking. More. Thank you. It's moving, so that's good. Look at the humerus, which is the main arm bone. That's normal. There are the forearm bones coming down to the hands again. And now we can see the head. It's still, oh, that's better. See the face there? Little profile, little side-on view of the face just there. And from this angle we can see the nasal bone. The longer this bone, the lower the risk of Down syndrome. And that is a good length. And now it's run away. Ah. Look down from the top of the head, the forehead bones. We come on down lenses to the eyes, just there and there. Come down a little bit more, that's the nose. And just here, this is the upper lip, and that is the heart palate. Just a slice right through there, so no gaps, so there is no evidence of cleft lip. We look from the side, it's got arms up in front of the face yet again. But in between those arms we can see where the eyes are. And that looks good. So the baby is very shy, but looking healthy. This down here is your cervix, is normal in length. This is your placenta, it's on the front wall, and it's normal in position. So the things that we go looking for at this stage all look normal. So any questions about baby?
Is it normal to be moving this way?
Oh yes. Very much so.
Yes.
Can't help you there. Some of them move more than this one, some of them move less. Nothing wrong with the movements. I would be happier if it had rolled over because pictures are easier to get, but it does what it wants. But there's nothing wrong with the amount of movement it's doing. It's a normal amount of movement. So baby looks good. So any other questions?
No.
Beautiful. So I'll let you wipe that gel off there. Measurements perfect size, growing very nicely. So baby is doing well. Very good.